Shaun, we constantly hear that time is of the essence when it comes to strokes. Why is that the case?
So when you have a blood clot on the brain, you're preventing blood flow, and that's leading to lack of oxygen, glucose and nutrients. So parts of the brain starts to die, and that occurs pretty rapidly. So unless we get the patients to hospital quickly, unless we open up the blood vessels and get restored blood flow to the brain, that part of the brain will die, and that will lead to permanent disability. So time is absolutely of the essence. The quicker we get you to hospital, the quicker we get you treated, the better the outcome for the patient.
Can you describe the two different kinds of strokes?
Yeah, the vast majority of strokes we see in Australia are due to a blood clot. And so that blocks one of the major arteries supplying blood to the brain. In about 15% of strokes, it can be due to a bleed. And, that's a challenge for us treating these patients, because someone comes to a hospital with stroke, we straight away don't know which one it is. And so we have to do a lot of tests to work that out. And it's important because it affects how you treat the patient.
So if you have a blood clot stroke and you reach the hospital quickly enough, what is the standard treatment?
So we have two treatment options. The first is a drug called TPA, and the function of TPA is to dissolve blood clots and to improve blood flow. The other option is we can actually retrieve the clot. We can use a device and pull the clot out and unblock your artery. Unfortunately, with either treatment, we can only treat a relatively small percentage of all stroke patients, and that's a big problem. Unfortunately, the majority of stroke patients still don't get enough benefit, and that's why we have a lot of death and disability in the community. And so we really need to improve on our treatment options. Yeah, so TPA has been around a long time. It was developed back in the 80s and 90s for stroke, with enormous potential to revolutionise stroke treatment. And in many patients, it has a great effect and they have a good outcome. Unfortunately, the majority don't get that great effect. And we actually know why. We know the limitations of the drug. And we've been working for many decades to try and come up with new treatments to add on top of TPA and to improve the ability to unblock blood vessels and improve blood supply.
And now I understand there is a new treatment that can eliminate those risks.
Yeah, so we know what we need to improve TPA, and we know that from treating patients who've had a heart attack. So if we add aspirin, which is an important blood thinner, we get a much better outcome when aspirin's combined with TPA. When we do the same studies in stroke and add aspirin with TPA, unfortunately, we get this bleeding on the brain, which, as I mentioned, is catastrophic. So we've been working for many years to try and get a safer aspirin, a drug that you can use with TPA without bleeding. And that's what we're really excited about, because our studies show that these new drugs are unprecedented. They just don't cause bleeding. So we're really excited to see how they perform in our stroke trials next year.
You talk about research, and obviously there's so many trials of new drugs going on all the time. How do you rate the impact of this one?
So, Joe, there's been literally 1,000 different approaches trialled in stroke. 1,000. Only one drug's ever been approved, and that's TPA. So we knew when we started this journey, this is one of the toughest, research assignments you could possibly get. That's why it's taken us so long. It's been painstaking research. But if we're right, and if this treatment does what we believe it's going to do, it could have a profound impact, because 16 million people every year around the world has a stroke. And it's one of the most difficult areas of medicine to develop new therapies. So, as I said, we're pretty excited that this could make a very significant difference, not just in Australia, of course, but ultimately globally.